So I'm at Dr. B's office here. And I'm gonna try this stem cell for my hair on my head that is slowly getting thinner. So can you tell me, how do the stem cells work in terms of growing the hair in my head?
Okay, so basically what you're referring to is PRP, which a lot of people are going to recognize it as PRP. And PRP stands for platelet-rich plasma or platelet-rich proteins. And how it works is we draw your own blood and we spin it down and we get those growth factors and all the good stuff that your stem cells produce in that small amount of plasma.
Okay.
And we turn around and we inject it back into your scalp. So the theory is that all of those growth factors and all of those rich platelets will stimulate your hair follicle for regrowth.
Is it actually putting stem cells back in my head, or what is it exactly in terms of stem cells?
What it's doing is it's taking your own stem cells and your own growth factors and stimulating the hair follicles that you have to kind of wake up and reproduce.
Okay.
Does that make sense?
Yeah, it makes sense.
PRP actually became really popular. I don't know if you remember when Kobe injured himself.
Right?
Yes.
Yeah.
So it was one of those things where you want to create growth in something that's injured.
Okay. And then I have seen that it works, but you have to do it a bunch of times in order to get the growth, or?
Yes, I recommend usually doing it at least 3 times, about a month to a month and a half apart, because you want that continuous stimulation. And then kind of like the idea of once the hair follicles are back on their feet, then you can maybe pull back a little bit and do it less frequently.
I like the fact that it's sort of natural, right? Because I mean, it's just my body that you're then...
That's exactly right. We're not injecting anything foreign or any kind of synthetic material. It's your own blood. We're just kind of concentrating all of those good things and growth factors that we like and putting them where we want them.
Okay, great. I'm excited.
All right, we're gonna get Lorena in here to draw her blood. The needle is very small. It really, you're going to feel little pinches. The needle is the smallest it can get. So if you need a little break, just let me know, but you should be fine.
Okay, all right.
Okay, here we go. I'm going to start a little bit here on the sides because most women tend to start thinning a little bit right at the temple area.
Ooh, okay, yeah.
And then we're going to go down the middle here in your part.
And is this just genetic or hormonal or what?
Hair loss can be a lot of different modalities. Thyroid is usually a big one for many women. So I like to do blood tests in the very beginning to rule out some other causes. Anemia, thyroid, there's some autoimmune issues that can cause hair loss. And sometimes it can be from stress. It can be from hormones. Yeah, every once in a while there'll be one that smarts.